And if you're just joining us, I'll give you 10 more seconds to take our poll. And I'm going to share those results. So it looks like folks are interested in all of the above. Great, because Megan, that's what we built our agenda around. But how to identify older adult health and social needs, what data I need to understand my older adult community, and looking at health disparities along with resources. So I think you're going to get a lot out of what we have teed up for you today. I am going to we want to recap our today's objectives. So in addition to all the things that you shared with us, we're here to learn about the landscape for understanding older adults and what data you can use, discover some age-friendly practices and frameworks, and talk about some resources to improve older adult health. I am so pleased because I now get to introduce our special guest, Megan Wolfe. So Megan is a senior policy development manager at the Trust for America's Health, leading the national age-friendly public health systems movement, which aims to make healthy aging a core public health function. Megan has more than 20 years experience in public policy and is sought after as a subject matter expert on age-friendly issues. And I know this because I sought her out. Megan has her undergrad degree from the University of Texas at Austin and earned a JD from the Antonin Scalia Law School. Megan, we are so excited that you're here with us today, and I'm going to turn over the presentation so you can share what you've been doing at Trust for America's Health, and we'll get into our webinar. So welcome.
Awesome. Thank you so much, Angie. Angie, good afternoon, everyone. Really appreciate your inviting me to share with you today about Trust for America's Health and our age-friendly public health systems movement. Really happy to share with you a little bit for those of you who are not familiar with my organization. On the next slide, you'll see some of the information that we provide. So we are a nonpartisan nonprofit focused on advancing policy that supports the public health system with a focus on equity. TIFA, Trust for America's Health, we call ourselves TIFA. We envision a nation in which the health and well-being of every person and every community is a national priority, and where prevention and health equity are foundational to policymaking at every level of government. We're really best known for our reports, including what you see on the screen, our annual Ready or Not report, which provides information about the readiness of state health departments for all kinds of emergencies, our Pain of the Nation report, our 2024 State of Obesity report will launch tomorrow. So if that's an issue that you're interested in, you can find that at www.tifa.org. Again, that'll be launched tomorrow. And then our healthy aging work is relatively new compared to the other stuff in our wheelhouse, having only started in 2017. But the Age-Friendly Public Health Systems, or AFPHS initiative, has now grown into a movement with a lot of state and community-led programs and initiatives emerging and spreading organically. And this is, of course, really gratifying to us and underscores the value and the interest in and need for age-friendly public health system. Our AFPHS website as well houses a wide range of resources, including policy briefs like the one you see on the screen here, that explores the alignment between age-friendly public health systems and the 10 essential public health services. Now, on the next slide, we're going to talk a little bit about demographics, because we know that the older adult population in our country is growing quickly in every single state and community. And although this growth has its challenges, we like to think of it as a true public health success story. Vaccinations have eliminated some diseases, as has clean water. Seatbelt and anti-tobacco campaigns have saved millions of lives. Maternal health, nutritious food. There are so many advances in our society that are attributable to the public health sector, but we don't think they're not kind of upfront. They're not in our face right now. And so we've just come to accept that public health is part of our community. It's part of what we do. It's part of our lives. So if you think about the numbers, though, we're not seeing the full picture. If you look at the charts on the next slide, you'll see that just the growth of the older adult population isn't the whole story, because our population is also growing more diverse. Between 2019 and 2040, the population of white Americans ages 65 and older is projected to increase by about 30%. But the racial and ethnic minority population is expected to increase by 115%, with the Hispanic population growth among older adults highest at 161%. That's a huge growth rate. So we have to be thinking about not just addressing older adults, but we also have to be thinking about systemic approaches to healthy aging and improving health equity. Now, on the next slide, I just want to share with you some of the preventable chronic conditions that some of our family members are facing right now. So you can see on this chart the percentages of older adults, 65 and older, that are faced with these challenges that are very costly to our healthcare systems and our public health systems. So Medicare enrollees with multiple chronic conditions account for 96% of Medicare spending annually. Almost all of Medicare is attributable to complex conditions. And even social isolation and loneliness have costs. They're costly to our health systems. A recent study found that social isolation actually increases the risk of heart disease, depression, cognitive decline, and death among older people, and accounts for $6.7 billion in Medicare spending annually. And we know that if we think about loneliness and social isolation, it's not just among older adults. So this is an area that we really have to think about attacking or addressing across the life course. And as we think about that, we can think about public health, because these conditions are preventable, and that's where public health comes in. So on the next slide, I show the definition of healthy aging as it's defined by the World Health Organization. And that's the process of developing and maintaining functional ability that enables well-being in older age. Now, we in public health know that healthy aging, as I just said, requires a life course approach, one that acknowledges all the factors that affect our health throughout our lives. So these include the physical, mental, and emotional factors that affect us as individuals, and the social and environmental factors that affect the health of our families and our communities. And we can't have a talk about healthy aging without also talking about structural discrimination based on race and ethnicity, because these structural discriminations, these drivers are really contribute to the health disparities and inequities that we see in our communities. And the public health sector is already working to address these. The public health sector is well suited to address these issues. Now, historically, older adult health has been relegated to the aging services sector. So when you think about healthy aging, you think about, oh, those are the people in my community. That's the area agencies on aging. Those are the senior centers. And that's true. They have years of experience delivering programs and services to older people and their families at the community level. But public health interventions for older adults are also really important. Unfortunately, up to now, they've really been limited by funding streams. So what gets funded is what gets done in the public health sector. And there's really kind of a general lack of awareness of what public health can do in aging. So we at TIFA have been working with partners like the National Association of County and City Health Officials, like the Alzheimer's Association, and state and local health departments as well, to change this. So we're going to take a pause here and do another poll. So Angie, I'll turn this back over to you for a moment.
Yeah, we're interested. I mean, webinars can always be so one-sided. So we're really interested in how you might already be incorporating older adults in your work. Are you looking at the subpopulation in your assessment? If you would take the poll real quick and just give us an idea of where you're spending your time and effort, or if you haven't yet started and that's why you're at this webinar, that's totally fine too. So we'll just give just a moment real quick. If you haven't taken the poll, let's give it 10 more seconds. And then I'll share this with you, Megan, as you get into your framework.
Sounds great.
All right, closing. 5, 4, 3, 2, 1. All right. Let's take a look. So it looks like a lot of folks are really doing outreach in partnership with local organizations, which makes sense. And including them in this, including older adults as a subpopulation, which we totally advocate for. Advocating for age-friendly policies, advocating in policy work, which I know you're going to touch on, is a really big lever. And there's some folks who are here to learn how they might incorporate this in their work. So we'll turn that back to you to talk about the framework.
Thanks, Angie. And I'm both happy and sad to see that that the framework isn't being used yet, because that means that you need to know about it. So if you go to the next slide, then I will start talking about our framework. So this is what we call our AFPHS 6 C's framework that provides guidance for the roles public health can play to improve and support older adult health and well-being and elevate healthy aging as a core public health function. We developed this framework to be flexible, to allow for health departments at all levels, multiple levels, to see themselves in this work, but also to be able to adapt it based on the unique needs of your community or your state, to be able to coordinate across sectors, and really, in some cases, just begin to take the first steps. So the 6 C's are, first of all, creating and leading policy systems and environmental changes. And we know how important having a champion in your community or your state health department is to seeing this work advance. And then the second one is connecting and convening multi-sector partners. And of course, public health is a great convener and does a lot of convening and coalition leading in numerous other issues. The third one is coordinating existing supports and services. And again, another crucial role for public health. And one that I think, again, is very well aligned if you think about the 10 essential public health services. And I will commend our report to you because it goes through all of the 6 C's and aligns each one with those 10 essential services. And there's a lot of work to coordinate. Collecting, analyzing, and translating relevant data. And we're going to come back to that one. Communicating important public health information. And of course, communication is a key role for the public health departments in the public health sector. And then finally, complementing existing health promoting programs. And this one is sometimes a little harder to get your mind around, because you first have to go out and find out what are those existing programs that support older adult health, and then how can the public health sector come in and complement those. So if we'll advance just one click, and I just really want to zero in on, this is where we're going to focus today, is on this, our what we call C4, collecting, analyzing, and translating relevant data. Okay, so on to the next slide. We really want to talk about, for the next couple slides, about the community health improvement, or the CHI process, that can be used to advance healthy aging by ensuring that older adults are included in the assessment process and in the planning processes. Through the CHI, we can work to better understand what's really driving inequities, what's really driving poor health outcomes among older people. The CHI process aims to address those root causes of inequities as well and poor health, so that upstream interventions, those public health interventions, can be implemented to benefit all people across the life course. CHI processes can be used to foster partnerships with organizations like AAA's, Area Agencies on Aging, and others that focus on older adults, including non-traditional partners like faith-based institutions. We're also learning how important it is to include older adults themselves, to engage them in the community health improvement process, to learn what matters directly from them in their communities. And then collecting data on older adults and their caregivers, because we consider the caregiver population really as part of this community of people that we're trying to support. Then analyzing and communicating that information, and then using it to identify strategies for policy and systems changes that really are the culmination of the CHI process. So on the next slide, I'm going to start talking about some examples. I'm going to give you a couple examples. So at the Florida Department of Health, they have created the Aging in Florida dashboard, which we think is the most comprehensive data dashboard on older adult health in the country. They've spent several years. They started this in 2018, so it's been an ongoing development process in the state of Florida. And then advancing one more, you'll see that in the Department of Health in Walton County, Florida, they use the data from the dashboard to identify mental health as a priority. And then advance one more, and they included an objective in their CHIP, Community Health Improvement Plan, to increase the percentage of adults with good mental health, and specifically to promote opportunities for social connectedness among older adults. So they started with their basic demographic data, then they looked specifically to some of the indicators on mental health, and then they were able to use that data to then formulate priorities and objectives within their CHIP. On the next slide, I'm going to show another example of using data to elevate the needs of older adults. And this comes from the Mississippi State Department of Health. So we started working with Mississippi in 2020, and they are a unified health department. So they don't have local, they have obviously counties, but they don't have local health departments. So all of the work we've done with Mississippi has happened at the State Department of Health level. They did not have data on older adults. And so we connected them with the University of Massachusetts, Boston, so UMass Boston. UMass Boston, by the way, loves to do this data work. They've developed profiles for Massachusetts, for New Hampshire, for Mississippi, and other states as well. So they collected the data and put this together and created the Healthy Aging Data Report for Mississippi. I know this is a little hard to read on the screen, but you can see that they've used the data to graphically display the density of the older adult population, to address health inequities, and a lot of other issues. And so this is the state snapshot that they have developed these profiles for every counties, so for all 82 counties in the state. Okay, on the next slide, we want to start sharing some information that we hope will be helpful to you, because we understand that not all jurisdictions are collecting this data. Not everybody has the capacity. It's just not being done in a lot of places. So we've been working with some of our partners, as I mentioned earlier, NACCHO, to support the expansion of this data collection on the older adult population. One of these resources is what you see on the screen, the Indicators of Healthy Aging Guide that we developed and published last year with NACCHO. It is aligned with MAP 2.0, which is, of course, NACCHO's CHIP tool, mobilizing for action with partners and policy. So MAP 2.0's 3 new phases include the partnering phase, bringing partners together to gather those resources. Thank you. I'll leave it there for a moment. The quantitative phase, conducting community health assessment, and the qualitative phase, development of the CHIP. So this guide is designed to help local health departments and partners understand and advance healthy aging through CHI efforts. It is designed to provide a comprehensive set of healthy aging indicators with measures and secondary data sources. And it is intended to inform strategic and action planning that can then lead to the creation, hopefully, of an age-friendly public health system in your jurisdiction. This guide was developed through a comprehensive review of literature, of other data sources, and with input from both folks who were subject matters in healthy aging and subject matter experts in the CHI process. The indicators and measures are widely available. They reflect local level data, and they are organized into 3 domains. So the health behaviors and health outcomes domain, the social determinants of health domain, and the third one is systems of power, privilege, and oppression. And that is really intended to get at those root causes of health disparities and inequities. So on the last slide, I just wanted to just kind of recap what this Healthy Aging Guide does. It really provides a roadmap for local health departments, for public health practitioners, for nonprofits and health systems and community organizations, all the partners that come together to do these assessments. This guide, this information can help them understand and advance healthy aging through that process. It is a comprehensive set of indicators and measures that connect with publicly available data sources. And because of the last domain focus on systems of power, privilege, and oppression, it really provides that opportunity to think about and center equity and social justice in this work around older adults and really have a deep understanding of their needs, of where the needs are in the community, and then to develop and implement those community-wide strategies and interventions that can improve the health of older people, really, and all people. So as we finish up here and we move on to the information that Angie wants to provide, I am going to drop a couple of links into the chat so you can have access to the guide and to our website. So with that, Angie, I will turn this back over to you. No, Angie, you're muted. There you go.
The consummate thing that it's kind of grown out of COVID, right? You're muted when you think you're talking to everyone. Megan, that is I'm thankful for TIFA's leadership in this area. Metopio is a platform that provides a lot of this data. We partner with public health departments and hospitals and other providers across the country to put their hands on that secondary data to really understand the subpopulations like older adults, and to rethink how we can shift our resources from that data collection to the analysis and centering community voice. I really love how you touched on, part of what we need to do in our community health assessments is really bring in older adults into the process, in our key informant interviews, in our community forums, as part of our planning processes. And so that's really important. And what I want to share with everyone is, Metopio does facilitate, and our platform helps support community health assessments with curated data and easy to use visualization tools so that you can really understand the populations and places you care about. We use, as Megan talked about, the gold standard in the industry, the MAP 2.0 process, so that when you're starting and kicking off this process, you have the data that you need to shift your efforts into that qualitative and primary data collection piece. And that once you understand the community, you have the resources and the ability to put together these programs and see them through to fruition to really create better health in your community. And so what I'm going to show you here is a really quick snapshot of the data that Megan was talking about. In Metopio, you can create your community health assessments. We have an automated process, as well as your community health improvement plans. And so now I get to really test my skills and show you the actual platform here. We're going to do a data snapshot of those some of those key variables that Megan was talking about. We have those curated in our database for you to use. And so here we've pulled across 35 variables that give you the stratification for 65 and older. So there's 35 of these here. We have benchmarked them to the United States. So you want to provide that benchmark. And one of the cool things that our data team has done is put together a rural benchmark. Because as we talk about understanding disparities, there's a big disparity in what health equity looks like in a rural area versus what it looks like in an urban area. So we've used the urban-rural continuum to shape for every state a rural benchmark. So you can look at these indicators by subpopulation and by your geography. So this is a really easy way to create this table with a couple clicks. And I just wanted to touch on a couple of these Megan and I were talking about. And one of the ones that's come to my attention more recently is just labor force participation and the change we've seen over time of older adults staying in the workforce longer, or maybe having to go back into the workforce to support their family or even to address some of their health needs. So as we scroll down here, I will point out another one, which, as the US Surgeon General has said, social isolation and community connection is really core to our health and a crisis in our country. This is an indicator that comes from the American Community Survey. We all use that for our work. But it's also called, in the American Community Survey, seniors living alone. And Megan and I were joking, this should be older adults living alone, because language matters, right? Right, Megan? So you can see here, we've got not only some indicators, but those social determinants of health and the community environment. So we have the demographics of children living with their grandparents. So many, different families have multi-generational homes. Some are, responsible for their grandchildren out of necessity. So what does that look like between an urban and a rural setting? What are the language barriers here? If we look here in we use Wisconsin as an example, we can see that in the county of Milwaukee, the limited English proficiency among 65 and older is a bit higher than it is either in Wisconsin or rural Wisconsin, but still below the US, which makes sense. We're in Chicago. I grew up in Wisconsin, so that seems to make sense here. And as we scroll down, we can see even more indicators about some of those health conditions. So just to touch on those real quickly, we can look across all of these at a granular level so you can understand your community, but also within that subpopulation. And you're able to compare these to the full population as well. So you can see the difference between vision difficulty with the entire population as well as the subpopulation of 65 and older. So when we do community health assessments, we do include seniors as a subpopulation. We oversample for that in our surveys, and we do at the age breakouts when we do the community needs assessments with our clients. This data is all public data. It comes from a wide variety of sources. I always joke that not all data is created equal. Some data is really granular, and we can get down to the zip code or the census tract, which gives us a lot of granularity. And other data sets are, kind of stuck at the state level. And while that gives us some directionality, it doesn't really help us understand our community. And that's where that primary data collection and getting out into the community and validating some of these points is really where we're trying to automate some of the secondary data work so that you can then take that into your community. So the other thing I wanted to touch on, which is once you have this data and you understand it and you've brought it together, you've done your community health assessment, then you want to do the community health improvement plan. So the second part of our platform really does take into consideration. I have an example here of, if older adult mental health was a priority that came out of your community assessment, you included all those age-friendly components that Megan was talking about, you can then build a action plan in Metopio. And we have a database of evidence-based programming from the CDC and What Works policies and others that you can tap into. So if you have a priority, you can look through what others have already done and see if that applies to your community. And if you don't have that, you don't see anything you want, you can use our logic model to create a program that you can measure over time. And we find that this is a really great, straightforward way to look at, where are you going to deploy your program? What are the inputs you need? What are the activities you're going to undertake? This should sound familiar to a lot of you. What are those outputs that you expect? And who are you going to partner with? We also provide a way for you to provide technical documentation to really document the program you're doing, because a lot of times what we find that our partners have had successful programs, and then the next chip and the next CHA, they're looking to scale those even further, find more partners to do more work because it's been really effective. And then the last piece is that you're able to come in here and set your own goals for short, medium, and long-term planning. And you can come in here and update this over time. And one of the cool things we've found is a lot of this work is being aligned more and more across the country. We see that public health departments are partnering with their hospital partners, their mental health boards, and others. You were talking about the area agencies on aging, the CCBHCs, or the community behavioral health centers. Everyone is doing these assessments. And as we can align these and actually put more resources to our aligned goals and objectives, we can do more. So a lot of our public health partners are excited to use this tool to actually reflect goal progress for the whole community. So we've come together and done this whole planning process. And now maybe out of these 85 folks we're trying to reach, 45 of the 65 were done by the public health department and measured, and 25 were done by our hospital partner, but together we're making an impact in our community. So it's just a really flexible way to take all of what Megan shared with you about thinking about how to incorporate older adults in this planning process, move it to the CHIP and the implementation process, and then measure your progress over time. So with that, Megan, if somebody took, actually, we wanted to be able to offer you a snapshot, that data snapshot. So Erin, are you able to launch that? So if you want a snapshot of your community for these 35 variables, just go ahead and quick let us know, and we'll make sure that we share this with you. This is, again, all publicly available data. It's very easy. It takes us a few clicks to generate this for you, and we really are trying to support you, including older adults, in your assessment. So go ahead and let us know. And then Megan, the question I have for you, and we'd love to open up for questions, and I'll check in the chat here in a minute. But we're interested in, if I do this age-friendly assessment and I find some priorities that I want to address, can you give our group some advice or some ideas about where they might go to either partner or some resources that they might want to use?
Yeah, so we, collaboration is really important in this work. As you said earlier, Angie, none of us can do all this work alone. And so, and thinking about all of these different processes and these different assessments that communities are required to do, from the local health department that has to do a community health assessment to age-friendly communities. So your age-friendly community convener has to do a livability assessment, and then nonprofit hospitals have to do their community health needs assessment. So those assessments can be aligned, and we've seen examples of how that happens. And that can help you identify partners. Like if you have an age-friendly community, if your community is an age-friendly community or an age-friendly state, who's the convener? Those can become great partners in this work. And so once you've identified some areas, it's the best thing to do is to find like-minded partners in your community to work on those. And I also wanted to mention that multi-sector plans for aging are being developed in states across the country. More than 25 states now are involved in that process. And this kind of data is really important to those processes as well. Not all of them include a data collection component, but we think it's really important. So if you're aware of that's happening, get to those tables and be part of that planning process as well.
Well, and one of the questions we got was about data. So a lot of folks, may be collecting their own data. Do you have any thoughts on either surveys or other data outside of the secondary data that's really informative that folks might want to look to include in their assessment? I know, for example, when we do these, a lot of times we'll be able to tap into some of the Medicare utilization data or hospital utilization data, or if you have that and you can look at a senior population, or sorry, again, older adult population, and look at the differences, maybe those disparities are a little bit more clear. Do you have any thoughts about other data that people should try to collect or maybe look for in their partnerships?
Yeah, I think anything that we can do to find data or information around the social determinants of health, I think it's really important. I mean, and we sometimes call those social drivers of health or health-related social conditions as well. So you'll see all, kind of those different terms of art, but those are really important to identify what's happening and how those impact health, like thinking about transportation, thinking about housing, thinking about just this access to services even. And that data is available in some jurisdictions. There's some data that's available through Medicare, but there's also the Elder Index. There's the ACL community, where you mentioned it, the community survey, right? And BRFS through CDC, the Behavioral Risk Factor Surveillance Survey. So there are a number of different types of data, and they're all listed as well in our Healthy Aging Indicators Guide.
Awesome. Monica wanted to know if you could repeat what the statewide coalitions that are working together on these issues are called.
Okay, they're called multi-sector plans for aging, and there are you can go to the website for the Center for Healthcare Strategies, and they have a listing of all the states. They actually have a map of all the states that are in the process of developing multi-sector plans for aging. California is the only state that is actually implementing their multi-sector plan. And so you can look up the California multi-sector plan. It's master plan. The California is a master plan for aging. The rest of them are multi-sector plans as they've come to be known now. And there's a connection to, I don't know if you've seen ACL, the Administration for Community Living, has recently released their strategic framework to develop the national plan for aging. And they're looking for comments on that by next week. So if anyone's interested in that whole process, I commend you to take a look at that plan. But they're all kind of interrelated, and it's really important for us in the public health sector to have a place at those tables and to have a voice as these plans are getting developed.
Yes, we have another with a completed CHIP and focus areas. Can what we already have set up, so if somebody's already completed maybe their CHA, for instance, and they didn't include the older adult population, I think one of the things you mentioned to me that is really interesting is, you know, what's good for older adults is good for the community. So we know we can't go back, but how do we think about that going forward? In terms of the social determinants of health and making those, you know, those preventative investments.
It's a tough one. I mean, I think that it's really important to think about what is your state health department doing? You know, what are the priorities in the state health improvement plan? And, you know, can connections be made there as well? I'm trying to make sure I'm understanding the question, but I do think that, you know, we just have to think about sometimes the big picture and distill that down to the community level, the smaller picture. I'm not sure I got to your question.
Yeah, I mean, I think the question was, you know, everybody's at a different stage in this cycle, and it's easy to hop in. And, you know, I think, as I said earlier, what we're seeing as a trend is more collaborations between the health delivery side and the public health side. And I think, you know, wherever you are in your process, whether you're implementing your CHIP or you're getting ready for your next CHA or whatever it is, you can always incorporate these. It doesn't matter if you have the focus before. And I think the investments around the social determinants of health really do lift up the whole community. If you're fixing transportation issues for older adults, you're likely fixing them for a community that suffers from transportation issues as well, right?
Yeah, absolutely. We work with several of the counties in Florida, county health departments, and in Sarasota, they rolled out what they call mobility maps that go from like the parking lot all the way to the beach. And the goal was to make the beach more accessible for older people. But as they rolled out these mats, they realized that families are using them that have strollers and carts where they're taking them. So it's exactly right. If you make a community more livable for one demographic, it's most likely going to be better and improvement for all demographics.
Right. And that's probably a great place to wrap up our conversation as we're coming up on our time together. Megan, this has been so informative and I'm so grateful for your time. I'm looking forward to learning more from Tifa and partnering as we go forward. And I know that everyone on the webinar has enjoyed it. We typically try to do these educational webinars on a regular basis. And the next one, we are going to be partnering with the National Association of City and County Health Officials to talk about AI in public health and how we need to take that into consideration and how it can actually help us with our sustainability and our capacity as we're being asked to do more with less, right? So if you're interested in joining us for that NACCHO partnership webinar, go ahead and let us know that. Megan, again, thank you for all of your time, and for everyone still with us. We will be distributing not only the recording, but the slides. And I know, Megan, you have a couple resources. You talked about that report coming out. So let's make sure that everybody knows about all the resources that Tifa has available.
Thank you. I'm happy to share those with you afterwards so you can send them out. And it was a delight to be with you today. I look forward to continuing to work with you and all of your team.
Great. Thank you, everyone. Have a great day, and we'll see you on the next webinar.